Of course, it's February, and that means it's National Heart Month. And we're here at Advanced Medicine, and I'm talking with Brooke Bentley about the Boston Heart Panel, a very specialized test that gives you a great insight to your patient's needs.
It really does. Heart disease is the #1 killer in Americans. So this is the Heart Month, and so we're focusing on Boston Heart.
Now, why the Boston Heart Panel as opposed to other tests that you can do with patients' blood?
You know, the standard lipid panel is just not good enough anymore, really, to be honest about it. Studies show that 1 in 2 Americans that have a normal cholesterol panel will have a heart attack or a stroke. And that's scary when you think about it. So the Boston Heart allows us to look at the entire picture, where I feel like the lipid panel only lets you look at part of the picture.
Right.
So you want to look at a person's total health when you're looking at it.
And it's very simple, just a blood draw, and you find out so much information.
It is. It's just a blood draw, and insurances cover it,
Right.
so that's the good thing. And then it looks at a lot of different information. So it looks at the LDL particle size and the number of particles that you have. It looks at plaque formation, you know, and is that plaque getting ready to rupture, and that's called Lp(PLA2).
Right.
It looks at genetic testing, so it's able to assess, are you going to have myopathies with the statin drug, you know, the side effects that everyone talks about in dreads with the legs bothering them and cramping. So it really gives us just a ton of information.
Now, if someone comes here and for instance, wanting to do weight loss, this is something that you definitely will get them involved in initially, right off the bat.
Oh, exactly, because that's going to give us a baseline to look at their health overall,
Right.
you know, and then we can compare that and repeat that in 3 to 4 months to see the improvements that we've made with weight loss.
And the Boston Heart Panel, I've had one done on me, and it's such an intense, it tells you, it's a book. I mean, it tells you so much information about yourself. And I tell you, the thing that got me was, it took a load off my mind. Because there's, you know, I found out what was wrong, but I found out what was right, too.
Exactly, and then you get to talk with the registered dietitian, and so they help you develop a customized meal plan so that you know what to eat and how to change things. Because a lot of times I think we get the information, but then we don't know what to do with it.
And that's what you help folks with here.
Exactly, yes.
All right. Advanced Medicine. Brooke Bentley, thank you so much for joining us today.
Thank you.
They can get you started on the Boston Heart Panel. It can get you on the road to better health.